everybody, welcome to Just Upright. My name is Doc Jane Ruder. I'm a doctor of physical therapy and I'm also a certified dementia practitioner. So welcome to Just Upright. If you are new to my channel, I always give a short tour. Go to the landing page, of Just Upright. You hit the video and you can see all the videos that I have made so far. If you're looking for a specific topic, I organize the videos based on the topic. So you hit the playlist, and right now I have 4 playlists there, like how to become a physical therapy in the US, PT documentation, and for older adults, fall prevention and other useful videos to increase your safety at home. And also I have how to become an on-call physical therapist, okay? So today I'm going to answer the question on how was my transitional to doctor of physical therapy, okay, my journey. So the first thing is that before you jump into doing a TDPT or transitional to doctor of physical therapy program, you have to know why. Why are you doing this? Okay, because when it gets so hard and very challenging, you have to go back to your why and you have to push yourself, okay? So you have to have a solid why. My why during that time is that I want to go back to teaching. I used to be a review lecturer in the Philippines and I taught for 8 or 9 years. I traveled the Philippines teaching physical occupational therapists how to pass their board examination, both local and then eventually for NPTE for physical therapists, okay? So I love teaching. I wanted to go back to teaching. That's why I went back to school after 19 years of graduating, from physical therapy before, okay? So you have to have a solid why. If your why is to have a better pay, because you will become a doctor of physical therapy. As of now, it's not the case, okay? Even if you're a doctor of PT, your paycheck is the same as the one with bachelor degree or master's degree, okay? It doesn't matter because the entry level right now is a DPT here in the US, okay? If your why is you're stuck with, your own 4 corners of your world, you're giving the same management, same goal, you cannot think outside the box anymore because you're not updated with the latest about the management in physical therapy, then go for it, okay? Because there are a lot of benefits. I will discuss what benefits I have gained in going to a DPT program, okay? So that's the first and foremost that you have to ask yourself, why? So the general overview of the program, I went to Evidence in Motion, okay? I asked the colleagues in Facebook group in ACTA, the Academy of Filipino American Physical Therapy. It's a Facebook group. And I asked for recommendations and many recommended EIM, Evidence in Motion, by that time. Okay, so I go for it and I was really impressed with their program. We have one teacher, Mr. Jason, and he was the best teacher we had. He really pushed us to become better therapists, okay? And it was very hard. That course, the musculoskeletal course with him, was toxic, meaning very hard, very demanding, but we gained so much from it. We learned a lot from it, okay? So it requires a lot of time, so usually there will be, like, if you have a course like musculoskeletal conditions, there will be, specific topics, and per topic you have to read a lot of research studies, because right now the new thing is evidence-based, So you have to read about different research studies, then you have to answer question, and when you post that answer, it's not like a Facebook post, like 1-2 sentence, and that's just your opinion. When you post to answer the questions, series of questions, it should be evidence-based as well. Your critical thinking will play a major part of this, and it's really good training for you to think outside the box, to look for research studies to back up your claim or back up your stand, okay, on your answer. So, there will be posting, and then my classmates can ask me questions, or my teacher can ask me questions. When I answer it, it should be evidence-based as well, okay, or back up by solid evidence when you post an answer, ideally, okay, not just your personal opinion, okay. So, and then sometimes some course has some project at the end of it, okay. So it requires a lot of time and dedication. When I started my DPT course, and I also had geriatric training along with it, and it took me 18 months total for DPT and geriatric certification training, because some courses overlap for both, okay. So I took the geriatric certification course because I work in nursing home. But in in EIM, if you go to their website, if you're an outpatient and you want to do manual therapy and doctor of physical therapy, then by all means you can choose that, okay. They have many options if you go to their website, and I can try to walk you through it later. I'll show you the video on the website and the choices that you have. But basically, yeah, it will consume a lot of your time. When I started the course, my daughter was 5 and my son was 3. So I have a 5-year-old daughter and a 3-year-old son. Okay, so life was crazy. So being a wife, being a mom, being a physical therapist, because I work maybe 3 to 4 hours a day, sometimes 5 or 6, it depends. So it's like part-time job. I'm a full-time on-call physical therapist, a PRN physical therapist. So I was working, and then we do homeschooling. Okay, and then later part of the course, I started a small business. So it was like chaotic, but I was not able to do it on my own. My husband, my children, they were so patient and supportive of me. So it really helps a lot that you have a good support when you're doing the DPT program and the course, because it can be very demanding. So for the most part, it's online, but it's interactive, okay? Meaning there's interaction among students and teachers, asking questions and answering the questions, and there are projects. And at the same time, there's also hands-on. We had 4 intensive training, 4 weekends of intensive training separately, okay, far apart from each other. So it will depend on you. They will have a list of locations where you want to get your weekend course. I don't know right now because of the pandemic. They might be doing virtual. I'm really not sure, but with me, we were able to do it before the pandemic started. So one tip is that if you are a member of Academy of American Physical Therapy, group, meaning you pay as a member, not just a member of the Facebook group, you will have a discount. They honor the members of that academy, and it's all worth it. Okay, the discount was all worth it. And what were the benefits for me as a physical therapist? Okay, so I can say that it has enhanced my critical thinking as a physical therapist. It made me think outside the box with new management, new techniques to improve the condition of my patient. It enabled me to learn how to find research studies, good research studies that I can read that are applicable to my patient so that I can give an excellent care, a high quality service to my patient. It enables me to be more confident in my making a goal, doing evaluation or progress note. And it just increased the overall competence as a clinician. So that is a great thing for me. Benefits. Of course, I was able to write a book also. If you see the book that I have written, it's available on Amazon, the Just Upright book, Practical Tips to Improve Posture, Balance, and Decrease Fall Risk. That is evidence-based as well. Truly, when you have the degree, even though you don't have any increase in paycheck, you will have the ability to find opportunities on how you can use the knowledge that you have gained. As long as you are open, as long as you are wanting to move ahead, to move forward, and not just stay where you are. So there are many opportunities out there besides the ones that I have mentioned. I'm gonna walk you through the website of EIM, and just for you to have an idea what are the courses that they put together with the DPT and other courses that you can combine it with if you want to go ahead and get your DPT program with EIM. Okay, so when you Google evidence in motion, and this will come out, then click that, and then you will come here to this landing page. So just type on the search bar DPT, submit. And so you can see this first part here, certifications with your post-professional DPT. And these are the other certification that you can get with EIM, DPT program, geriatric pelvic health, executive program in practice management, sports PT, manual PT, therapeutic pain specialist, and post-professional DPT in musculoskeletal management. Right? So I hope that answered the question of one of our colleagues about how was my experience with DPT program. I certainly highly recommend it. It's all worth all the time and the sacrifice and the effort in exchange for what you will learn and how it will enhance your ability as a clinician to give a higher quality of care to your patient. And also I forgot to mention that ideally, since there's no financial reward right away after you get your doctor of physical therapy, if you are financially stable and you have the resources, meaning you're not going to get in debt because of going back to school, that is the most ideal situation. But of course, to each his own. If you want to do it now and use a credit card, it's really up to you. But for me, it worked out well when we have the resources so that I was able to get my degree without being in debt. So if you have any other questions, clarification, suggestion, just leave a comment down below. I appreciate your time and thank you for supporting the channel. Please share this channel so we can reach as many more therapists as we can in different parts of the world. Thank you so much and stay blessed. Thank you so much for watching. Please do not forget to hit the subscribe button below to be updated with the latest video releases. Share this channel to other people you know who will benefit from Just Upright videos. Thank you again and stay blessed.